This is just a short tutorial on iPrescribe. This is a service that we signed up for so that we can electronically submit prescriptions to pharmacies. This will be useful in particular situations where somebody needs pain meds and they live out of town and it's not convenient for them to come to Lafayette to pick up a prescription. It also will allow us to be able to get prescriptions to the pharmacy so that patients don't have to show up with a written prescription, give it to the pharmacist at CVS and wait for an hour or have to come back to pick it up. So I want everybody in the front to kind of get familiar with it. Same thing with the dental assistants, so that you can, it takes a little bit fooling around to get used to, but it's not too bad. I went ahead and put in the most commonly used medications that we prescribe on this list that now is in the program. And just to go over a few things, I've got some, I went ahead and printed this out for the front office. This is standard pre-op dose for amoxicillin. This is what we'd use for infection. This is for sinus cases, pre-med for ortho or cardiac. Cendivir we've been using for penicillin allergic patients instead of clindamycin. That's Omnicef. Cefadroxil is the same as Duracef. Cephalexin is K-Flex. This right here is Flexeril. Hydrocodone 5, 7, 5, and 10 is Norco. Levofloxacin is Levaquin. Piperidine is Demerol. And this right here is Zofran. Oxycodone with acetaminophen, that's the generic form. We also have Percocet on here. And promethazine, either rectal suppositories or tablets, is Phenergan. And tramadol is Ultram. And triazolam is Halcyon. The reason I've written all this in there is because they only allow you to select these generic names, and these are the brand names here that everybody's a lot more familiar with. So just to show what that's all about. Now the next thing is, we'll go ahead and pick out a patient. In this case, we picked out Rebecca to go ahead and write a prescription for her. You go into this right here, and you go to clinician, click that on, and then we'll go ahead and go to prescription history. And we're going to put new prescription. We go to the drop-down menu, put the date in, Saturday, today's date. You type in the first few letters of the drug, and your drop-down list comes up. So we have amoxicillin, one every three times a day for 10 days. Dispense 12, 4-day supply, and then you use a drop-down menu to pick out the pharmacy. So like for Walgreens, we type in the first 3 letters, and we get all these stores that Rebecca's put into the system. We have a few more to add, and now we've got it all done. Then we come over here, try CVS out on Pinhook, select that. Then we've got to make these choices. Are we going to save this as a preference, or a prescriber preference, or a facility preference? No refills. And then we go ahead and submit it. Here's the prescription here. If we want to print the prescription, we can. We go to prescription history. We want to cancel it, which is what I did here. We can select that, cancel the prescription, and that's it. So that's the whole thing in a nutshell. Pretty slick. Pretty slick. The other thing is there's an app for the iPhone, and it essentially does the same thing if you don't have access to a nearby computer. And this is just a little video showing what it's all about.